Welcome, everyone, to a comprehensive look at eosinophilic pneumonia. This lung disease, characterized by an abnormal buildup of eosinophils in the lungs, can present in various forms and impact individuals differently. Join us as we delve into the intricacies of this condition, covering its causes, mechanisms, diagnosis, treatment, and more. So, what exactly causes eosinophilic pneumonia? The etiology can be quite diverse. In many cases, it's idiopathic, meaning the exact cause is unknown. However, several factors are known to trigger or contribute to its development. These include parasitic infections, fungal infections like aspergillosis, exposure to certain drugs, particularly medications like antibiotics, NSAIDs, and some anti-seizure drugs, occupational exposures, such as inhaling fumes or dusts containing organic materials, can also play a role. And in some instances, eosinophilic pneumonia is associated with underlying autoimmune diseases or allergic conditions. To understand eosinophilic pneumonia, we need to examine its pathophysiology. The core of the problem lies in an exaggerated immune response in the lungs. When the lungs are exposed to a triggering agent, whether it's a parasite, drug, or allergen, the body's immune system reacts. This reaction involves the recruitment of eosinophils, a type of white blood cell, to the lung tissue. These eosinophils release inflammatory substances, such as cytokines and toxic proteins, that damage the lung tissue. This damage leads to inflammation, fluid accumulation, and ultimately, impaired gas exchange, resulting in breathing difficulties and other related symptoms. Eosinophilic pneumonia is not a common disease, and accurate epidemiological data can be challenging to obtain. Acute eosinophilic pneumonia, in particular, is considered rare. Chronic eosinophilic pneumonia is also uncommon, but its prevalence may be slightly higher, affecting more women than men. The condition can affect individuals of all ages, but chronic forms are more frequently observed in adults between the ages of 20 and 50. The incidence can vary geographically depending on exposure to certain parasitic infections or environmental triggers. The signs and symptoms of eosinophilic pneumonia can vary depending on the type and severity of the condition. Common symptoms include shortness of breath, cough, often dry but sometimes productive, fever, fatigue, night sweats, and chest pain. In some cases, individuals may experience wheezing similar to asthma. With acute eosinophilic pneumonia, symptoms tend to develop rapidly, sometimes over a few days. Chronic eosinophilic pneumonia, on the other hand, typically presents with a more gradual onset of symptoms that can persist for weeks or even months. It is important to note that these symptoms can overlap with other respiratory illnesses, making accurate diagnosis crucial. Diagnosing eosinophilic pneumonia requires a combination of clinical evaluation and diagnostic testing. A thorough medical history, including medication use and occupational exposures, is essential. A physical examination, paying close attention to lung sounds, is also important. Key diagnostic tests include a complete blood count, which often reveals elevated eosinophil levels. A chest X-ray or CT scan of the chest can show characteristic patterns of lung involvement, such as infiltrates or opacities. Bronchoscopy with bronchoalveolar lavage (BAL) is often performed. This involves inserting a flexible tube into the airways to collect fluid samples for analysis. The BAL fluid is examined for increased eosinophil counts, confirming the diagnosis. Lung biopsy may be necessary in some cases where the diagnosis remains uncertain after other tests. Eosinophilic pneumonia can be broadly classified into acute and chronic forms. Acute eosinophilic pneumonia, or AEP, develops rapidly and is often associated with a new exposure, such as cigarette smoking or a drug. Chronic eosinophilic pneumonia, or CP, has a more gradual onset and is characterized by persistent symptoms and eosinophilia in the lungs. There are also specific subtypes related to underlying causes, such as parasitic infections or drug-induced reactions. Understanding the specific type of eosinophilic pneumonia is important for guiding treatment decisions. Treatment for eosinophilic pneumonia typically involves corticosteroids, such as prednisone. Corticosteroids help to suppress the immune response and reduce inflammation in the lungs. The dosage and duration of treatment depend on the severity of the condition. In acute cases, a short course of corticosteroids may be sufficient. Chronic cases often require longer-term treatment, with gradual tapering of the medication to minimize side effects. In addition to corticosteroids, other medications may be used to address underlying causes. For example, anti-parasitic drugs may be used if a parasitic infection is identified. Supportive care, such as oxygen therapy, may be necessary to manage breathing difficulties. While it's not always possible to prevent eosinophilic pneumonia, certain measures can reduce the risk. Avoiding exposure to known triggers, such as certain drugs or occupational hazards, is important. If you are a smoker, quitting smoking can significantly reduce your risk of developing acute eosinophilic pneumonia. Practicing good hygiene, especially when traveling to areas with parasitic infections, can help prevent parasite-related cases. If you suspect you have symptoms of eosinophilic pneumonia, seek medical attention promptly for early diagnosis and treatment. The prognosis for eosinophilic pneumonia is generally good, especially with prompt diagnosis and treatment. Most individuals respond well to corticosteroids and experience significant improvement in their symptoms. However, chronic eosinophilic pneumonia may require longer-term management to prevent relapses. Recent research is focusing on identifying specific biomarkers that can help predict treatment response and personalize therapy. Studies are also exploring the role of targeted therapies, such as monoclonal antibodies, to selectively suppress eosinophil activity in the lungs. These advances hold promise for improving outcomes and reducing the need for long-term corticosteroid use in some individuals with eosinophilic pneumonia.